Hello, my name is Kayla, and I chose to research cognitive behavioral therapy treatment for substance abuse in adults. According to Healthy People 2020, substance abuse is a set of related conditions related to the consumption of mind and behavioral altering substances that lead to negative behavioral and health outcomes. In 2005, around 22 million Americans suffered from a drug or alcohol problem, and 95% of them were unaware of their problem. Substance abuse affects individuals, families, communities, and it can be costly to social, physical, mental, and public health problems, including domestic violence, child abuse, motor vehicle crashes, physical fights, crime, homicide, and suicide. In Wisconsin, the per capita alcohol consumption rate is 1.3 times higher than the national rate, and heavy drinking among adults is more common in Wisconsin than the nation as a whole. Women of childbearing age in Wisconsin consume alcohol at higher levels than their national peers. In Wisconsin, there has been an increase in the use of prescription drugs for non-medical purposes, which aligns with national trends as well. Rates of marijuana, other illicit drugs, and non-medical use of pain relievers are highest among young adults ages 18 to 25. The first study I found consisted of two groups, treatment as usual, which served as the control, and a group cognitive behavioral therapy for depression and substance abuse. The cognitive behavioral therapy group consisted of 18 two-hour sessions divided into 3 modules: thoughts, activities, and people interactions. The group met twice a week for 9 weeks. 73 participants were included in the study. Study findings showed at 3 months post-baseline, both groups reported significantly fewer days of problem substance use. Clients in the intervention condition also significantly reduced the number of drinks per drinking day, where the control condition did not. Data from baseline to 6 months showed improvement in days of problem substance use for the intervention group. In addition, the proportion of participants reporting 100% days abstinence from problem substance use at 3 months for the intervention group was 73%, compared to 62% for the control condition. Study limitations include that the participants' abstinence could not be completely measured due to it being an outpatient treatment. Monetary incentives were introduced into the intervention group, as many of them reported issues attending sessions due to transportation, childcare, and work challenges, although those through analysis that did not seem to affect the results. The study demonstrated that group cognitive behavioral therapy is an appropriate and effective intervention in decreasing substance use and promoting abstinence from substances. The second study consisted of a computer-based cognitive behavioral therapy for alcohol use. 3 groups were included in the treatment, which was treatment as usual, serving as the control, treatment as usual plus the computer-based version of cognitive behavioral therapy, and a computer-based cognitive behavioral therapy with brief clinical monitoring. The computer-based cognitive behavioral therapy component included access to the web-based program in a private room at the clinic. There were 7 modules, each covering basic cognitive behavioral therapy concepts. 68 participants were included in the study. Study findings showed an overall increase in abstinence during the 8-week treatment period among the sample as a whole. There was a more rapid increase in days abstinent across time in the treatment as usual plus the web-based version group compared to treatment as usual. The percentage of heavy drinking days per week decreased in the sample as a whole and decreased more rapidly in the treatment as usual in addition to the web-based version group compared to just the treatment as usual. There was a significantly higher rate of percentage of subjects with no heavy drinking days in the web-based version group compared to treatment as usual. At the 6-month follow-up interview, there was significant effective time for percentage of heavy drinking days, with an overall decrease in heavy drinking during the follow-up period. Limitations of the study include a small sample size with lower alcohol severity overall compared to larger trials. There was found to be high satisfaction rates from the participants. The study demonstrated that the cognitive behavioral therapy web-based treatment did in fact lead to a more rapid rate of abstinence and higher rates of percentage of subjects with no heavy drinking days. The intervention would be feasible to perform at other facilities and allows for easier dissemination of the intervention as it is mostly done by a computer-based program. Similarities of these 2 studies include that they were both randomized controlled trials. They both use cognitive behavioral therapy as an intervention to treat substance abuse, although the study performed by Kulik et al. Used a computer-based cognitive behavioral therapy program, whereas the study performed by Hunter et al. Used a group cognitive behavioral therapy. Both studies used recall methods in order to assess alcohol and substance use by the participants. They both also used objective tests such as alcohol swabs, urine drug tests, and breathalyzer treatments to assess for current alcohol and drug use. A difference among the studies include that Kulik et al. Focused on alcohol as the primary substance of abuse, whereas Hunter et al. Included multiple drugs of abuse. Strengths of the study designs include that participants were chosen and randomly assigned to treatment and control groups. Both studies use objective measures to assess for alcohol and drug use, which verify self-reports. Although with both programs being outpatient treatment, substance use and abstinence may not be completely accurate. A weakness of the study performed by Hunter et al. Was the introduction of the monetary incentives, although that did not appear to affect the results. The two studies discussed are of value for the advanced nursing practice as they both indicate that cognitive behavioral therapy is an effective treatment for alcohol and other drug abuse. They both show that cognitive behavioral therapy is a feasible treatment for substance abuse and that different forms of therapy may allow for easier and increased dissemination of the treatment. Findings from the literature review support cognitive behavioral therapy as an effective therapy for patients suffering from substance abuse illness. Cognitive behavioral therapy can be administered by a psychiatric mental health nurse practitioner, and with increased amounts of these programs, we can treat more patients in a timely manner. Mayo Clinic describes the components of cognitive behavioral therapy and what is to be expected for treatment. It may be done with one-on-one sessions or in groups with family members or others who have similar issues. The length of therapy is usually about 10 to 20 sessions depending on severity of symptoms, how long the addiction has been going on, and how quickly progress is made. During the first session, the therapist will gather information and ask about concerns and goals that the patient would like to work on. Current and past physical and emotional health will be reviewed so that the therapist can fully understand the patient's situation. In continuing with therapy, the therapist encourages the patient to talk about their feelings and troubles and usually focuses on a specific problem such as the addiction, and it is goal-oriented. Steps of the process generally include identifying troubling situations or conditions in life, becoming aware of thoughts, emotions, and beliefs about the problem, and identifying and reshaping negative or inaccurate thinking. Patients may also be instructed to work on these skills and homework assignments outside of the therapy sessions. With a similar approach as described above, the psychiatric mental health nurse practitioner could use cognitive behavioral therapy to treat those suffering from a substance abuse illness. This would most likely occur in an outpatient setting such as a clinic, but it could also be used in inpatient drug abuse treatment facilities. Please let me know if you have any questions.